Alrighty. Did it kick you out too?
Yep.
All right. Of course it did. All right, let's see if I can do. Ah, no. Okay, here we go. Mrs. Ellis has it together now. There we go. All right, let me make that bigger for you. All right, which of the following serves as a reservoir for urine? A, the kidney, B, the ureter, C, urethra, or D, the urinary bladder?
Urinary bladder.
Correct. It is that bag-like organ that is in your pelvis. Urine is actually produced in the kidneys, and then the ureter transports them from the kidney down into the bladder itself, and then the bladder pushes it out through the urethra. Alrighty. When attempting to maximize the amount of drag during a gliding technique, what should the therapist do? A, significantly increase the use of oil or lotion. B, use no oil or lotion. C, mildly reduce the amount of oil or lotion used. Or D, make no change in the amount of oil or lotion, as this is entirely dependent on client preference.
Use no oil or lotion.
Correct, because what's the other term for drag?
The other term for drag,
Mm-hmm.
is it force?
It is an F word. We want to create friction.
Friction, okay.
And yep, oil and lotion are lubricants, and when we use lubricants, we lose friction. Ooh, we were just talking about this one a moment ago. Here's a pathology one for you. Which of the following skin disorders is caused by the herpes virus? A, a corn, B, a cold sore, C, a wart, or D, hives?
Um, oh wait, which of the... Can you read it one more time?
Sure. Which of the following skin disorders is caused by the herpes virus? A, a corn, B, a cold sore, C, a wart, or D, hives?
Hmm. I want to say, okay, yeah. Cold sore?
Definitely a cold sore. It's actually a viral disease. It has like watery blisters on or near mucous membranes like the lips, and it is caused by the herpes virus. Corn is basically a keratin buildup, a really thick layer of your epidermis on the foot.
Yeah.
And then a wart is also caused by a virus. And it's a protrusion in the skin, but it's not the herpes virus. And then the hives are a skin reaction that can happen either to an allergy or to really strong emotions. Stress does such wonderful things to your body.
Hmm.
Fun fact, cold sores become much worse during periods of stress as well.
Mm.
All right. A 45-year-old male client comes to a massage therapy clinic. At the first session, the massage therapist asks what his goals are in attending massage therapy. Which of the following is an appropriate goal? A, increasing awareness of the body. B, reducing pain through manipulation and adjustment of the spine. C, diagnosing the cause of chronic shoulder pain. Or D, improve renal function through reflexology.
Okay, so he's coming in for massage, so it's not C, not diagnosing anything.
Correct.
Um, we're also not chiropractors, so it's wouldn't be B.
Correct.
Um, I think increasing awareness of the body.
That is the correct answer. Now, according to the AMTA, it also says that reflexology is out of your scope of practice. I would
Oh yeah.
argue that with proper training, you can, but here we are. Which of the following types of movement does not describe a motion that is performed by the wrist? A, flexion, B, retraction, C, adduction, D, extension.
You can you can flex the wrist, so it's
Correct.
not A. Um, you can you can also do extensions of the wrist too,
Correct.
so it's not D. Um, what else? And then I feel like you can also at ADD adduct. You can
Hmm.
add to your wrist. I feel like you can't really retract by your wrist.
Correct. Like a retractable leash, the line gets sucked back up into it. You can't suck your wrists up into your forearms. There is no retraction with the wrist.
But you can do retraction like to your shoulders, right?
Your shoulders can go back, yes. You can pull your shoulders back, but you cannot with your wrist. Your wrist joint does not allow for that movement. All right. Pathology. When assessing a client at her initial visit, a massage therapist notices the client has a yellowing in the sclera of her eyes and a yellowish tint to her skin. When asked about this, the client states she has not noticed it before and has not seen her doctor. Of the following options, what is the best course of action for the massage therapist? A, call the client's doctor immediately. B, tell the client to speak with their doctor about this finding at their next physical. C, ask the client to sign a release of information so the therapist can contact her doctor directly and discuss these symptoms, and instruct the client to call her doctor immediately and make an appointment for further assessment. Or D, refuse treatment, take no further action.
It's not D. Um, I feel like ask the client to sign a release of information so the therapist can contact her doctor directly.
Correct. Yes, you don't want to call the client's doctor without them signing a release first. Um, and definitely you don't want them to wait to talk to their doctor until their next physical, which could be a year from now. You definitely want to contact them further. Do you know what that yellowing of the eyes and the skin is indicative of? What that could possibly be?
Um, Yellowing of the eye. Um, I can't think of it right now.
So when the eyes and the skin become yellowed like that, it is typically a sign of jaundice,
Jaundice.
which,
Okay.
yep, it's called jaundice, and that is caused by, do you remember?
Um, can't you can't you get it from like like hepatitis?
Yes, liver dysfunction. Excuse me. Liver dysfunction. So any hepatitis would affect the liver. Um, any type of liver dysfunction could cause signs of jaundice.
Just typically if someone was like drinking and that affected their liver, then when they have like yellow eyes too,
When they
if
get
they're heavy.
cirrhosis, potentially, sometimes alcohol will cause other issues, like with the blood vessels. A lot of times you'll see like the bloodshot eyes and stuff. But when you start getting that liver dysfunction, yes, you absolutely can start getting signs of jaundice. Alrighty. Kinesiology. All of the following are present in muscles except for what? Light touch receptors, muscle spindles, nociceptors, and Golgi tendon organs.
Mm, Fine. Um, hmm. Um, would it be um D?
Did you say D or B?
D.
D. Um, Golgi tendon organs are in your muscles. They sense the changes in the tension of a muscle.
Okay.
Do you remember what these are, nociceptors?
Is that where like you can feel your surroundings?
They send pain signals to the brain.
Signals.
Mm-hmm. Muscle spindles. Do you remember what they do?
Muscle spindles since change muscle.
Muscle length.
Okay.
So the correct answer is going to be light touch receptors because those are primarily in the skin. Muscles are not actually super sensitive to light touch at all. We experience that in the skin.
Okay.
All right. Which of the following tissues is not a type of muscle tissue?
Um, C.
D is correct. This is an elastic substance that is usually found where? Where would you find hyaline cartilage?
And your wrist?
You'd find it on articulating surfaces of joints. It helps make them move smoothly and cushion the bones. You also find it between the ribs and in the respiratory system um, to help hold shape. Ooh, the next one's a neurotransmitter question again. Here we go. Which neurotransmitter is responsible for influencing motor activity, especially fine movements? Now, in my class, I always talk about this neurotransmitter as being the motivation chemical. But remember, this one influences motor activity, fine movements. This is the neurotransmitter that would be most affected in Parkinson's disease.
Dopamine.
Dopamine, correct. And if you're over medicated for Parkinson's disease, what pathology could you potentially get that is an overabundance of dopamine?
Overabundance. Uh, Wait. I feel like you would.
It's a mental disorder. Sometimes medications for Parkinson's cause this mental disorder, and sometimes the medications for this mental disorder can lead to Parkinson's like symptoms.
PTSD?
Schizophrenia.
Oh, okay.
Schizophrenia, it's a scary correlation between the two. PTSD is post-traumatic stress dysfunction disorder, depending on who you talk to. They are making arguments, just so you're aware, to change it to PTSI and calling it an injury so that
Mm.
veterans, most especially men, will start to get treatment from it and think of it less as a mental disorder and more of a literal traumatic brain injury, because PTSD actually does alter your brain makeup in most cases.
Mm.
Anyway, sorry, sidetracked. Nerd. Fill in the blank. During blank, complex molecules are broken down and energy is released.
Oh, B.
B is correct. That is when they are broken down and energy is released. Anabolism is another function of metabolism. Do you remember what metabolism is?
That's when the body breaks down like food, nutrients.
And converts it to energy.
Yes.
Um, yep. And mitosis is, what is that?
Something with a cell.
Correct. This is a throwback to week 1 of 105. It is when a cell divides.
Okay.
Kinesiology. If a treatment area is described as proximal to a given anatomical point, which area of the body is being described? A, further away from the client's trunk. B, closer to the client's head. C, closer to the
Closer
client's
to the
trunk.
lines. Yeah.
Yeah, C. All right. If a client is unable to feel your touch on a certain area of the leg, what type of nerves are most likely affected? A, afferent, B, radial, C, efferent, or D, cranial?
Mm. So A,
A is correct. Do you know why A is correct?
um, Isn't that the nerve that that can sense like touch?
Yes, and it sends signals from the body to the central nervous system. The efferent nerves, C, is when information is sent from the central nervous system to the nerves and make them move, make a motor unit move. Like they'll make your hand jerk away from a hot stove. So you are correct. The answer is A, because that is the type of nerve that sends signals to the central nervous system about what's going on. So in this case, they could also have damaged touch receptors, light touch receptors that we were talking about earlier.
Oh yeah.
Which of the following is not true of draping? A, disposable draping materials should be discarded after each client and not reused. B, reusable draping materials on a massage table, such as sheets, should be changed once a day. C, the genital area is never draped. Or D, only the area that is currently being massaged is undraped.
Um, reusable draping material on a massage table such as sheets should be changed once a day.
Correct. You definitely want to change them between every
Every
client, not
client.
just once a day. Gross. Especially when we got that athlete's foot dude we were just talking about earlier.
Uh-huh.
Please, please change your sheets. All right. A client presents with many serious and ongoing symptoms that appear related to gastrointestinal distress. Based on their understanding of pathology, the therapist believes this client may have Crohn's disease. What is the best course of action for the therapist to take? A, continue massage as usual since this is outside the therapist's scope of practice. B, refer the client to a physician. C, diagnose the client with Crohn's disease. Or D, refer the client to an acupuncturist.
Okay, I don't know what D is really gonna do. um, I would just if it was um I wouldn't continue. I would just refer the client to another person. B.
Yes, it's B. You would refer them to the physician. Depending on how severe the distress is, you could or could not continue the massage, but you would definitely refer them to a physician. They may not be completely contraindicated for a massage depending on how they feel at the
Okay.
time. But you definitely would not be making a diagnosis, obviously. And you would definitely refer them to a physician for a proper diagnosis.
So if this happened at like a spa, I would still refer them.
I would definitely tell them to go to see their physician.
Okay.
It really depends on your employer's rules, what you could or could not do. They may not allow you to pass out names of doctors. If you're
Okay.
working on your own, I would definitely pick a physician or two that you like to be able to refer clients to. And I would do that for several different types of practices, like find like an orthopedic specialist, maybe a physical therapist that you like, and refer them there. Fill in the blank. A massage therapist should exercise caution when massaging the cubital area in order to avoid injuring the blank. The subclavian artery, B, the radial artery, C, the popliteal artery, or D, the brachial artery.
Mm, Can you read it one more time?
Fill in the blank. A massage therapist should exercise caution when massaging the cubital area in order to avoid injuring the A, subclavian artery, B, radial artery, C, popliteal artery, or D, brachial artery.
Um, the radial artery.
Correct. It is the radial artery. Do you know where the cubital area is? The cubital fossa?
It sounds like it would be like in the neck.
It is the space in your elbow where the arm and the
Oh, okay.
forearm meet.
Oh, okay.
So your subclavian artery below clavicle would be in the triangle area of the neck. Popliteal, do you remember where this area is?
That's the back of the knee.
Correct. And then the brachial artery, brachia, and usually we're talking about the upper arm, you would exercise caution in the axilla, in the armpit area. All right. Client assessment, reassessment, and treatment planning question. Massage therapist wrote the following as part of a client note. Client RPTD, minimal reduction in P exclamation point post cess period. Will CONT with TX as previously outlined. How could this be improved?
Reduce
A,
the number of
of abbreviations.
yeah.
You're like, I'm already tired of listening to it.
It
Like that
looks
was a hot
too complicated.
mess. Oh, maybe we should assess this therapist for facial droop as well. All right. Did you have a stroke while writing this? Yes, you have to be careful of your abbreviations because not all abbreviations are universal. They could have different meanings in different companies, different regions, different healthcare fields. It could have different meanings associated to abbreviations. So you really need to make sure that when you do use them, that they are understood correctly by the receiving healthcare teams if you are sharing them or if you use them in something like a legal case. All right. When applied appropriately, what effect will deep transverse friction have?
Break
A,
up soft tissue.
and
Adhesion.
adhesion and scars. Yes. Excellent. All right. Oxygen in the human body is an example of which of the following? An atom, a cell, an organelle, or a molecule?
Mhm. Oxygen. It is. I think it's D.
It is D. This one kind of upsets me.
Could it be
Um,
A though?
yes, and here's the problem because true oxygen is O2. So it's two oxygen elements and it's an atom, okay? And they're put together to make O2, which is a molecule because it's two atoms combined. When you combine two or more atoms, okay? So a more appropriate question would be, is water an atom or a molecule? Because then you have hydrogen and
Mhm.
oxygen together, and then combining those atoms would make a molecule. This is kind of a trick question because oxygen by itself is a chemical element and is an atom, but oxygen that we breathe is two oxygen molecules together, O2. I'm not going to go into the whole electron valence shell and all this nonsense, but they work better as a pair instead of a single. They're too volatile as a single. So the answer should almost always be a molecule because they're very infrequently seen alone. But yes, the answer could both be A or D. But for the purpose of the MBLEX and AMTA, the answer is D, and Mrs. Ellis is too autistic to like it. I hate it. I hate the question. It's just like lordosis. It's hyperlordosis.
Yep.
Okay. If nothing else, you'll remember me being outraged. Okay. What is rheumatoid arthritis? A, the inflammation of white blood cells. B, an autoimmune disorder that affects joints, causing inflammation and degeneration. C, a viral infection that creates swelling in soft tissue structures. Or D, a disorder that affects joints with inflammation and degeneration as a result of mechanical forces.
Well, arthritic, I can't pronounce it.
Arthritis.
Yes. You can already tell it's like something with the joints in the hands and feet. Um, oh,
And my
yeah.
knee.
Yep. So I am gonna go with B.
Yes, rheumatoid arthritis is different than osteoarthritis. Rheumatoid arthritis is an autoimmune disorder. When we have an active inflamed period, a period of exacerbation, we do not massage it. You can actually inflame it and make it worse. Oh, here's a question I haven't seen before, and I don't cover this when I talk about the digestive system, but I really should. Here we go. In most healthy adults, how long is the small intestine?
40
I hit,
to 100.
it's 24 to 30,
Oh, dang it. Wait, is
although
that
a
the
100-foot intestine would be impressive.
wait, is that the large one or no?
That's the small intestine.
What about the large one? How big is that one?
It's shorter. It's thick and it's short. I want to say like 15. Let me look it up real quick. I don't want to lie to you. Large intestine length. About 5 feet or 1.5 meters long. It forms that sort
Oh,
of almost a circle, not quite. It's like a U shape that cuts in and then dips down to the rectum. So when you're doing like constipation or large intestine massages, is you work clockwise to massage along the upper ridge of the abdomen and then down along the left lateral side to start working it down through it. Yep, it is. According to these other sites, that's not EMTA.
I got
It's
spiral.
usually 20 feet long for the small intestine. So we're going to go with the 24 to 30 feet.
Okay.
Right. Oh my goodness. I read this wrong. This says a massage therapist works at a medical clinic, and I thought it said at a medieval clinic. I was like,
Oh,
this is gonna get interesting. All right. A massage therapist works at a medical clinic under the supervision of a doctor. A client repeatedly asked the therapist for her personal cell phone number so that the client may text him about scheduling appointments. Which of the following is the best response by the massage therapist? A,
decline
decline.
and tell them about have them call the clinic for appointments.
Yeah, clearly. I mean, you don't know. They're scheduling up front. I mean, your schedule is going to get all kinds of messed up if you have them doing
They're also not
things.
that special.
Don't tell them that. They'll stop coming. They all have to believe that they are the most special. All right. Which of the following is not an example of objective data that would be recorded in the objective section of a SOAP note? A, girth measurement over right ankle. All right. How big is our cankle? B, visible swelling and redness of left knee joint. There's my arthritis. C, review home exercise program during next session. Or D, shoulder active range of motion to 120 degrees flexion.
Review home exercises.
Correct. That is not objective data that you are observing on your client. A massage clinic has been very busy for the past week, and the owner didn't have time to do the laundry. In her 15-minute break between clients, a massage therapist notices there currently are no more clean fitted sheets. However, other linens are still available. What should the therapist do? A, cancel the next client's appointment. B, turn the current sheets inside out for the next client. C, use the same sheets again since they do not appear visibly soiled. Or D,
Skip
strip
the
the sheet.
sheets. That one.
Yes. Yes. Use clean, flat sheets, blankets, whatever. Cover that table and drape the next client. Improvise, but do not reuse. Massage therapist has 10 years of experience working almost exclusively with the geriatric population. A client appears on his schedule who is a semi-pro baseball player with neck and shoulder pain. What is the most appropriate action for the therapist? Refer the client to a physician secondary to the presence of shoulder pain. Refer the client to a massage therapist who specializes in sports massage. C, treat the client with aggressive techniques. Or D, treat the client using techniques he normally uses with geriatric clients.
Send him over to someone that specializes in sports massage.
Correct. Healthy connective tissue allows for mobility within a muscle or joint. What substance allows for this? Is it A, fibrocartilage, B, elastin, C, collagen, or C, hyaline cartilage?
Hmm. It's not. It's not D.
It is not
Hmm.
D.
It's not A.
It is not A. That's a dense connective tissue that barely moves. You find it, that's the type of cartilage like in your ears and in
Mhm.
your intervertebral discs in your spine.
I'll go with B.
B, elastin. Yes. Mobility can be used interchangeably, sometimes with flexibility. It allows you to be elastic and move. Ooh, we just talked about this one not too long ago. In another type of question. Which sensory receptor would be primarily involved in the extensor carpi radialis with non-painful wrist flexion? A, the muscle spindle. B, nociceptors. C, chemoreceptors. Or D, fascicles.
The muscle spindle.
Correct. Because that's a sensory receptor that detects changes in the length of the muscle. And since the extensor carpi radialis muscle is an extensor muscle, it extends, that muscle spindle is going to tell us how much we're extending that muscle. Which type of sensory nerves detect irritation and pain? Mechanoreceptors, proprioceptors, ooh, my favorite, nociceptors, or chemoreceptors?
Mm, Wait. Um, C.
C is correct. Mechanoreceptors respond to pressure, movement, and touch. Proprioceptors, that's like our sixth sense. That's where we sense where we are in space. And then chemoreceptors sense chemical changes like oxygen levels in the body. Nociceptors detect irritation and pain. They can also detect when pressure is like too deep.
Oh. Okay, I can do one more question. One more question, and I gotta go after that.
No problemo. Alrighty. Last one. A client reports an aching pain in the low back, which began immediately after a car accident 15 years ago. At first, the pain was very sharp and could be pinpointed to the L4, L5 region. Now, the client is unable to locate a specific worse spot. The pain has been present ever since the accident, but the character of the pain has changed significantly over time. How would these symptoms most likely be classified? A, idiopathic pain, B, chronic pain, C, breakthrough pain, or D, acute pain?
A.
A, idiopathic pain. When we say something is idiopathic, we don't know what the cause is. So,
Oh,
like when we say someone has idiopathic encephalopathy, we don't know why their brain is swelling. We don't know what is causing it. So that would not be the answer.
okay. So it's now chronic pain.
It is chronic pain. Anytime acute pain period is passed and now it's just sort of aching, like it used to be sharp, but now we can't really pinpoint that worst spot and it's been there for a while, it is chronic pain. Last question with this one. Do you remember what breakthrough pain is?
Um, is that when it's like unbearable?
That's when you're taking pain medication. And in those periods where the medication is worn off before you take more medication, your pain suddenly spikes because it's no longer being dulled by that medication.
Hmm.
Alrighty, that was our last one for today. You know how to reach me if you want to do one at a different time other than next Wednesday at 12. Otherwise, I'll be there in case you want to be there.
Okay, that sounds good. Thank you.
Okay, awesome. All right, talk to you later.
Have a good day.